My name is Ana Fadic, and I am the Vice President of Men's Health Network, a national nonprofit organization that's based here in D.C. Our main mission is to educate men and their families where they live, work, play, and pray about different men's health information, educational programs around mental health in this case, but also different cancers and nutrition. So we have spent years working with the bipartisan Congressional Men's Health Caucus, currently co-chaired by Representatives Donald Payne Jr. of New Jersey and Markwayne Mullin of Oklahoma. We would like to take a moment to thank them and the Congressional Men's Health Caucus for making this briefing possible. We will be hearing from Congressman Mullin in just a few moments. We are honored to have you in attendance at this briefing today for veterans and active military, mental health, and suicide issues. As most of you know, suicide among veterans and active duty servicemen and women is an ongoing and unfortunately an often overlooked tragedy. A 2018 report from the VA using 2016 data says that the suicide rate for veterans was 1.5 times greater for Americans who never than for Americans who never served in the military. About 20 veterans a day across the country take their own lives, and veterans accounted for 14% of all adult suicide deaths in the U.S. in 2016. Relevant to us is that the suicide risk for veteran males is 90% higher than those of non-veteran adult men. We have a very distinguished panel here today to discuss these topics of suicide and mental health, so we're going to get started. A bit of housekeeping, we're going to have a question and answer session at the end, so please write down your questions, and after each presentation we may be able to take 1 or 2 questions for the speakers. Congressman Mullin, would you like to come up and say a few words?
Well, first of all, thank you, and thanks to all of our speakers for being here. This is a very, very important issue, and what a turnout. I really didn't expect that. We got a lot of things going on in the Hill right now, and so for you guys to take the time to simply come up here and talk about men's health with specifically the topic of suicide. We had 121 veterans commit suicide in Oklahoma last year, and every one of them were males. I have a good friend of mine to which I have probably spoke to him twice over the last 3 months, literally talking him off the edge. I could go through numbers and people to which I have had those conversations with, and men's fitness, men's health is more than just us being healthy, but it's the mental part of it too. And a lot of that comes down to a routine. Guys, a lot of times in our life, we can't control everything around us, but we can get a sense of accomplishment by having a routine of physical fitness. My routine is I get up every morning early, regardless of what time I go to bed, and I start my workout because in the mornings is the only time I can control. After that, I'm reacting, but I had that sense of accomplishment already completed, which a lot of time is enough to push me over to get the day completed. When we have our veterans that are coming back and they're getting out of the service, in the service they had a rank, they had a job, they had identity. And when they get out, they lose all that. I had a guy one time that was talking to me, a good friend of mine, ex-Green Beret, or I guess always is a Green Beret. And he was talking to him and he says, man, when I was in the service, I was in charge of multi-million-dollar equipment. I knew what my mission was, and we were good at it. And I come here and people won't even trust me with a shovel. And he's struggling. This guy currently is still struggling. He speaks for a lot of our veterans, men and women, that's coming back. And that's why our suicide rate is actually an epidemic that we're facing right now. And so for our speakers to be here, to give their time, for you guys to gather in this room, which is extremely warm, and to give your time, and bring awareness to this, we're all in this fight together. Because there's not one of us that could be in this room if our veterans wasn't out there keeping us safe so we could be here. As we said before, there's 1% of the population protecting 100% of our freedoms. And when they come home, we need to give them all of our attention. And if it's just giving them awareness, if it's just giving them a routine, if it's just letting them find their identity again, or as some say, find their why, then guys, I'm all in. So anything I can do to help, anything you need from my office, consider it done. And once again, thanks for taking the time. Speakers, I can't thank you enough. This is our 3rd time to schedule this, I believe. This wasn't ever scheduled for the 2019. This is called persistence. So we got it right finally. God bless you all. Thank you so much.